Professor Glen Mola reflected that after completing 72 hours of continuous on-call duty over the Easter weekend for emergencies in obstetrics and gynaecology at Port Moresby General Hospital, PMGH, he had been compelled to speak out. He reported that unlike other hospitals, where patients receiving care on the floor would warrant an incident report, at PMGH's maternity ward, 10 to 30 women are cared for on the floor daily due to a lack of bed space. In 2024 alone, over 7,000 women reportedly received part of their maternity care on the floor, including in the labor ward, birthing areas, and postnatal ward. He stated that senior medical staff had repeatedly reported this degrading and humiliating situation to PMGH management and even included it in annual reports. Management had been shown the conditions firsthand on at least 2 occasions, but no action had been taken. He explained that while staff had avoided raising the issue on social media for years, attempts to resolve it through official channels had failed. Professor Mola revealed that in 2022, the Japanese government, through JICA, offered a grant of approximately $100 million to build a new perinatal center. The plans, developed collaboratively over 10 months by specialists and PMGH and NDOH representatives, included much-needed facilities such as additional beds, an ICU for mothers and newborns, and a dedicated laboratory. However, PMGH's board, advised by the CEO and management, rejected the offer, citing it did not align with their vision, which included building 8-storey towers near the morgue and turning the existing maternity site into a hotel and commercial area. He expressed that had the project gone ahead, the perinatal center would have been completed and operational by now, alleviating the current crisis. He described how staff were forced to step over patients on the floor and struggled to move emergency equipment due to overcrowding. Over the weekend, he had to console 2 mothers who lost their babies and the families of 2 young women who died, in part due to inadequate space and resources. He also mentioned ongoing problems such as empty soap dispensers, no paper towels, and malfunctioning power and lighting in the birthing areas, all of which compromise care. He acknowledged the efforts of nursing managers and coordinators over the past 4 or 5 years, but said little had changed. Despite potential backlash, he felt compelled to speak out for the sake of his conscience and the future of maternal health care in Port Moresby.